Liver cancer caused by viral hepatitis typically develops slowly over 2 to 3 decades. Most people don't get signs and symptoms in the early stages of primary liver cancer. There are steps you can take to get screened for the infection and prevent it from progressing. What are the leading causes of primary liver cancer? Cirrhosis, or scarring of the liver, is primarily caused by excessive alcohol consumption. Infection with the hepatitis B or C virus, which causes up to 80% of primary liver cancers worldwide. Cirrhosis, liver scarring. Cancer caused by infection with this virus can last for years. People become infected through physical contact with the blood or bodily fluids of a person who has the virus in their body. Infection with the hepatitis B or C virus can occur through unprotected sex, sharing contaminated needles, receiving a blood transfusion. Ways to prevent liver cancer. Cirrhosis is scarring of the liver, and it increases the risk of liver cancer. You can reduce your risk of cirrhosis by adopting healthy lifestyle and weight management. Drink alcohol in moderation, or if possible, avoid. Maintain a healthy weight. Get vaccinated against hepatitis B to prevent risk of liver cancer. You can lower your risk of contracting hepatitis B by getting the vaccine. Almost anyone can receive the vaccine, including infants, the elderly, and people with compromised immune systems. Reduce the risk factors. Cirrhosis is scarring of the liver. You can reduce your risk of developing liver cancer by adopting healthy lifestyle habits such as regular exercise, weight management, and a healthy diet with limited alcohol consumption. Get the hepatitis B vaccine. Don't touch or reuse dirty or used syringes or needles. Get medical care if you have chronic hepatitis B. Treating chronic hepatitis B reduces your risk of liver cancer. Don't drink alcohol in excess. Regular, heavy alcohol use can damage your liver. Quit smoking. Take measures to prevent hepatitis C to prevent liver cancer. There is no vaccine for hepatitis C exists, but you can reduce your risk of infection. Understand the health status of any sexual partner. Don't have unprotected sex unless you know your partner isn't infected with HPV, HCV, or another sexually transmitted infection. If you do not know your partner's health status, use a condom whenever you have sexual intercourse. Avoid using intravenous, for drugs, but if you do, use a clean needle. Avoid injecting illegal drugs to reduce your risk of developing HCV. However, if that is not an option for you, make sure any needle you use is sterile and do not share it. Hepatitis C is often transmitted through contaminated drug paraphernalia. Take advantage of your community's needle exchange programs and consider seeking help for your drug use. When getting a piercing or tattoo, look for shops that are safe and clean. Needles that are not properly sterilized can transmit the hepatitis C virus. Before getting a piercing or tattoo, visit the shops in your area and inquire about their safety practices. If employees at a shop refuse to answer your questions or do not take them seriously, this is a sign that the facility is not for you. Disclaimer. This video contains general information and discussions on health and related topics. The information and other content in the video, as well as the linked materials, are not intended to be used as a substitute for medical advice, diagnosis, or treatment. Please consult your doctor before beginning a new medication or health regimen.